So today on stage are hormones. And this is one of my favorite topics because I think it is just so interesting. Where do we start? How about the Bible? A story that just about everyone is familiar with is a story of David and Goliath. And you remember how David took a slingshot and got Goliath in the forehead with a stone, and Goliath dropped. Very interesting story. And then David, of course, went off to chop off Goliath's head, and it was the triumph of the little guy over the big bully. How did this happen? Well, one suggestion is that Goliath suffered from multiple endocrine neoplasia, which is a disease that causes excessive growth because of improper growth hormone regulation from the pituitary gland. Visual problems, again, associated with improperly functioning pituitary. Low blood sugar, improperly functioning pancreas. And a soft skull because bone formation, not properly regulated because of an imbalance in the parathyroid gland. So basically, we can say that Goliath had hormonal problems. These problems have been with us ever since. So let's have a real scientific look here. And let's get into our time machine. I always like to take a look, as you know, with a little bit of history, because if you know what's happened before, you have a pretty good guide about what is possible to happen in the future. So we'll climb into our time machine and make a stop first in the latter part of the 18th century with Dr. John Hunter, one of the most famous physicians at the time. And he was interested in anatomy. He was one of the great anatomists. And he was also interested in the anatomy of animals. And he focused on roosters. The roosters were not too happy with this because Hunter castrated them, meant removal of their testes, and he observed that their combs on top of their head would shrink and wither. He had no real explanation for this. It was just an observation. But it was quite obvious that there was some sort of connection between the gonads, the testes of the rooster, and the comb sitting on top of the animal's head. And then along came Arnold Berthold just a little bit later. And he also was interested in roosters. Roosters were not these doctors were not the favorites of roosters in those days, obviously, because Berthold also castrated roosters, but then he went one step further. And he returned the testicle into the body cavity of the rooster, which is where it is anyway. The testes are not outside, like with humans. For the rooster, they're in the abdominal cavity. And he returned it there, and it turned out that the rooster showed normal sexual behavior, and the comb, again, became normal. So obviously, the testes were somehow releasing something into the bloodstream. But Berthold had no idea what this was. Again, he just made this rather interesting observation. And then Thomas Addison started to basically put hormones on a more scientific footing because he studied humans. Thomas Addison was interested in the adrenal glands. These little glands sit right on top of the kidneys. And he noticed upon autopsy that in some patients, those adrenal glands were shriveled away, and that the patients, before they had died, had shown poor appetite, low blood pressure, they were weak, suffered from anemia, and their skin was discolored. So he made the connection that the adrenal glands were doing something to prevent these conditions. And the next step was taken quite logically from this observation that people who had withered adrenal glands suffered from a low blood pressure, that there must be something in the adrenal glands that can elevate blood pressure. And indeed, very soon after Addison's discovery, the idea that the adrenal glands is releasing something that prevents these symptoms, that was followed by the use of such extracts to raise blood pressure. And so they didn't know, of course, what was in these extracts. They just mashed up adrenal glands, made an extract of them and injected it. And it turned out that this was one way to raise blood pressure. And then Charles Brown-Séquard. And what an interesting man he was. Trained as a medical doctor. And it's interesting in a sense that he was born in Mauritius. And there's even a stamp made after him in Mauritius. But he had triple citizenship. He was born in Mauritius, but his parents were English and French, so that he had English, French citizenship. And then he moved to the US, and he also acquired American citizenship. And he, in fact, traveled back and forth between America and Europe, and made contributions all over the place. His interest was in the testes of animals. And he was quite convinced that there was something that the testes were releasing that was important to health, because he had noticed that castrated animals did not do well. And he thought that there was something in there that the testes produced that had a rejuvenating effect. And then he really pushed this idea, because he went on to inject himself with the macerated testicles, first of guinea pigs, then of dogs, when he was already becoming a senior citizen. And he thought that this would have some sort of a rejuvenating effect. And he claimed that, yes, it actually made him feel young again. It was a very interesting development in I guess, what we would now call anti-aging therapy. And as you can imagine, there were hucksters back in those days as well, just as there are today. And whenever there's a new scientific discovery, the scam artist will jump in and take advantage of it. So not soon after Brown-Séquard gave his celebrated lecture about feeling young again, having injected himself with these extracts, there were products that appeared on the market. These, of course, had really nothing to do with him. They just stole his name. And these were various extracts, as you can see: testicle extract, gray matter extract, thyroid gland extract, etc. And the idea was that this would have a rejuvenating effect. And there were many, many of these. Some of these were called Séquarine, after Séquard. And he actually sued some of these companies for the misuse of his name. So this kind of stuff was going on then, just as it goes on today. Well, one of his followers, one of his disciples, was Serge Voronov, who actually was a Russian doctor. Originally, he was Sergei Voronov, but he moved to France and took on the French name of Serge. He had another interesting idea. He thought, gee, if injecting the extracts of these testes can have a rejuvenating effect, what about just making use of the whole testicle? His idea was to take male testes and insert the testicle into the scrotum of a man to see if it had a rejuvenating effect. Now, as you can imagine, there was a dearth of potential donors for such an experiment. So he made a deal with the French government, executed criminals who were hung in those days, and he would have access to their testes. And he would remove the testes soon after they were executed and insert them into the scrotum of men. And surprisingly, there was no lack of men who wanted to undergo this therapy, because when men start to feel that they're getting old, they will do almost anything to have some rejuvenating quality. So he carried out these experiments. No complications, really, because he just inserted the testicle into the scrotum. He didn't attach it to anything. But of course, soon he ran out of executed criminals. So what's the next best thing? Chimpanzees, our closest relatives. So he started a farm, actually in Italy, where he raised chimpanzees purely to be testicle donors. And he took the testicles of chimpanzees, inserted those into humans, and he carried out some 1,700 such operations, he and his disciples, all across Europe, with not many complications. And it was an interesting era. He documented this in his classic textbook, as you can see, Rejuvenation, and by Voronoff. Not everyone was enamored of this technology. Sir Arthur Conan Doyle, the creator of Sherlock Holmes, was a medical doctor. Luckily, not a very good medical doctor, because it was while he was waiting for patients who never came that he had time to write the Sherlock Holmes stories. He didn't think that this business of testicle transplants was the right approach to rejuvenation. He thought that this was pushing the envelope of science too far. And he wrote a story about this, actually, The Adventure of the Creeping Man, one of the Sherlock Holmes stories. As you may know, there are 60 Sherlock Holmes short stories and 4 novels. One of these was The Adventure of the Creeping Man. And it was a story of an aging professor of physiology. And Sherlock Holmes was called into the case when his children found him in the backyard swinging on a tree, limb from limb. And as you can imagine, what he had done was injected himself with monkey gland extract and had made a monkey of himself. And this was Conan Doyle's way of reproaching all of these real-life experiments that were being done with testicle injections and testicle transplants. In North America, John Romulus Brinkley got himself a mail order medical diploma, which you could do in those days. He did some apprenticing with a physician, and he thought that he knew a way to make some money based upon what he had been reading about from Sécard and from Voronoff and what was going on in Europe. Brinkley had grown up on a farm where he had noticed the antics of goats. And he knew that goats were very horny. He knew that he did not have an access to male testicles to replicate what was going on in Europe. But he sure enough would have had access to goat testicles. So believe it or not, Brinkley, an untrained doctor, began to do goat gland transplants. And Dr. Brinkley became famous for this. If anyone suffered from any kind of male problem, such as impotence, off they would go to Dr. Brinkley. And of course, he would recommend his usual procedure, which was a goat gland transplant. And he carried out a large number of these, again, with virtually no complications. And because, again, he just inserted it into the scrotum. He never attached it to anything. And he had a very, very successful career, made a lot of money, which he eventually lost because pretty soon there were all kinds of lawsuits against him, people dissatisfied with the technique. But not everyone was dissatisfied. There is one famous case of a farmer who had come to Brinkley complaining that his wife had suggested that he was sort of a flat tire. And he did what Brinkley always did. He did a goat-to-man testicle transplant. And a year later, he got a letter from the gentleman, from the farmer, thanking him because he had felt so invigorated. And not only that, he had also fathered a son. And amazingly, he called the son Billy, supposedly after the goat who had donated the testicle. So it was quite incredible, these things that were going on. And this was just over 100 years ago, so it's not ancient history. All right, well, let's take a look at some of the other endocrine organs, as we call them. Endocrine organs are the organs that release hormones. Now, the word hormone comes from the ancient Greek, to stir into action. because that is what hormones do. Hormones are substances that are released by a gland, and they go through the bloodstream to stimulate activity somewhere else in the body. And the pituitary gland is a tiny little gland that is located almost smack in the center, geometric center of the human brain. And it's roughly the size of a pea. Here's a rather fascinating look at it. This is taken through an optical fiber with a tiny little lens at the end of the fiber. And you actually see the pituitary gland here. And this gland produces about 1/1,000,000th of a gram of hormones per day. That's 1 microgram. That's such a small amount that you could not see that with the naked eye. And yet we could not live without this. So hormones can be active in very, very, very small amounts. And that's one of the most fascinating things about hormones, is how little, in terms of concentration in the body, and what an impact these can have. Well, the pituitary gland is sort of the conductor of the hormonal orchestra, because it is the gland that actually sends out signals to other glands in the body to carry out whatever their function is. So, for example, the pituitary will produce ACTH, that's adrenocorticotropic hormone. This stimulates the adrenal gland to crank out its own hormones. Oh, and there are, as you can see, many, many others. Thyroid stimulating hormone. The signal goes to the thyroid gland to produce hormones. Signals go to the ovaries in females and the testes in males to carry out their job. Hormones go to the kidneys to stimulate their own production of hormones. So you can see why the pituitary is looked on as the conductor of this hormonal orchestra. There are a large number of hormones that the pituitary gland produces. Prolactin, somatotropin, ACTH, follicle-stimulating hormone, thyroid-stimulating hormone. These are just some of them. So, for example, prolactin is the hormone that allows women, after they have given birth, to provide breast milk. That could not happen without the pituitary. Growth hormone is what allows us to grow. Now, if there is some issue here, if the pituitary produces either too much growth hormone or too little growth hormone, then you have conditions of gigantism or dwarfism. And this can be very, very impressive. For example, this gentleman here was called General Tom Thumb. And you see him next to P.T. Barnum. P.T. Barnum, of course, was one of the greatest showmen of all time, and he would collect curiosities. And General Tom Thumb was a curiosity because he was a perfectly formed little man, under 3 feet tall. And people were very keen to see this sort of marvel of humanity. And he was basically such of small stature because he had an improperly functioning pituitary gland. Now, if you have an over-functioning pituitary gland where it produces too much growth hormone, then you get something like gigantism. And many years ago, I had the chance of meeting Sandy Allen, who at that time was the largest woman who had ever lived. She was well over 7 feet tall, as you can see here. She kind of exhibited herself in a museum in Niagara Falls. Very nice lady, very interesting to speak with. She had a car, she drove a car actually, where the front seat of the car had been totally removed. So she sat on the back seat because she could reach the pedals with her feet, and she had an extended steering wheel. Unfortunately, she has passed away because generally these people don't live very long. The heart has to work too hard to pump all of that blood. The male equivalent of Sandy Allen was Robert Wadlow, who was well over, he was actually over 8 feet tall. I think he was 8 feet 1 inch. And he also died at a very young age from heart disease. But he was, as you can see, a very, very impressive height. And he was also a pituitary giant, too much growth hormone early on in his life. Now, the knowledge of growth hormone can, of course, be also useful in diagnosing illness. You may recognize this gentleman here. This was Andre the Giant. Andre the Giant was 7'4", weighed about 500 pounds or close to 500 pounds. And he also suffered from producing too much pituitary growth hormone and suffered from this condition called acromegaly, where, as you can see, this kind of these strange, it has sort of a strange facial appearance because the bones have overgrown in the face. Andre died when he was in his early 40s. Again, these people don't live that long. Now, there can be certainly benefits to using growth hormone. When you have children who are born with an improperly functioning pituitary gland, and we really should refer to them as people of short stature, the terms dwarfs and midget are frowned upon scientifically. But these days, this can be treated because you can use human growth hormone, and you can make them grow a normal height. If it's diagnosed early enough, and it usually is, because you notice when a child isn't growing, and when they do the test and they find that it is due to lack of pituitary hormone, well, these days they can be injected with pituitary hormone, and they can have a normal life and normal growth. So human growth hormone is a protein, as I said, which is made by the pituitary gland. And in early research, they would extract the hormone from the pituitary of cadavers. And that sometimes resulted in problems because the pituitary can also have some viruses in there, which you would be transferring if you just do an extract. And today, there's no real concern about that because human growth hormone can be manufactured through recombinant DNA techniques. That is, the gene that is known to produce growth hormone has been isolated from the human genome. It can be incorporated into bacteria, and the bacteria will then produce human growth hormone. Back in 1990, a major experiment was published in New England Journal of Medicine, headed by Dr. Daniel Rudman. And they had looked at what happens when you take senior men and inject them with growth hormone. Now, what stimulated this research? Because as we grow, as we get older, the body produces less and less growth hormone. So the question was, could there possibly be some benefit to restoring the growth hormone levels that young people have? It's sort of an interesting, idea to pursue. So they enlisted volunteers who would be treated with human growth hormone, and in those days it was still extracted from cadavers, and it was a very expensive business because that's a very difficult process. But they enlisted a number of men. And interestingly enough, after being injected with human growth hormone, they did well. They did well. For example, there was increase in muscle and other lean tissue, decrease in fatty tissue, increase in skin thickness, increase in the density of bones in the lower back. I mean, these are good things. And as you can imagine, the press got a hold of this, claiming that all of a sudden the secret to the fountain of youth had been found. Well, the fact is that this study was stopped after 6 months because a number of the subjects experienced high blood pressure, increased plasma glucose, carpal tunnel syndrome, and breast enlargement. Of course, the press didn't report on that. They just jumped on the original observation. And in fact, Daniel Rudman had to write a letter to the New England Journal saying that there had been these unforeseen consequences and that the study was stopped early and that they were not recommending human growth hormone injections. Of course, the scam artists got into this, and all kinds of clinics opened up where they were claiming to inject people with human growth hormone. Nobody knows really what they were injecting, because what they were charging could not possibly have paid for human growth hormone, which in those days was very expensive. So those clinics were eventually shut down by the government. But in any case, in the Rudman study, even though there were these measurements before that seemed optimistic, there was no actual improvement in any kind of physical performance. But that too has been forgotten by the promoters of these clinics, most of which have been shut down. So here was another one. This the claim to rejuvenate people. But again, what they were injecting, nobody knows, because human growth hormone in those days cost about $17,000, and they weren't charging that much. But anyway, after the government got after these, and as you know, you can't keep a good scam artist down. They will always come up with something. And they have. I mean, these days, you can make human growth hormone through recombinant DNA technology. So in theory, one can sell real human growth hormone, and it is available because the cost has come down. However, in many cases, what they are claiming to be human growth hormone isn't. There are legitimate companies that sell human growth hormone, but a lot of the companies are just scam artists. So it is available. And if you have the money, I mean, it's not cheap. It no longer costs $70,000 an injection. It's not cheap. It's available. And people like Sylvester Stallone have used it, and they claim that it is somewhat responsible for keeping them young, although there are no real clinical studies today that would confirm that. But human growth hormone legitimately can be available. But as I said, many of the companies that claim to be selling human growth hormone are not selling that. Then there's another type of scam that they are pulling, and that is the sale of what they call human growth hormone activator or human growth hormone secretagogues. And this allows them to make a claim that they're giving you the raw materials that the body needs to make human growth hormone, and insinuating that the body will use those materials to make the hormone. Never mind that there's no real clinical evidence that the hormone, even if you could make it this way, does any good. But here's the argument that they use. Human growth hormone is a protein, which is true. Proteins are made of a chain of amino acids, and human growth hormone needs specific amino acids in specific amounts for the body to convert those amino acids into the hormone. So these growth hormone activators claim to have just the right blend of amino acids in the right amounts in order to form human growth hormone. And there are many of these. You can buy these in health food stores. And as you can see, make the claim, lowers body fat, increases muscle tone, etc. Well, they're playing a pseudoscience game here. It is absolutely true that it contains the amino acids the body needs to make human growth hormone, but that doesn't mean it's going to use these to make the hormone. This is kind of like taking an empty lot and piling bricks and doors and windows on that empty lot and waiting to see if they will self-assemble into a building. Well, that, of course, is going to be a very long wait. This is a very good analogy for this, because the body gears down its production of growth hormone not because it doesn't have enough raw materials. Of course, we eat enough protein. We have all the amino acids the body would need. But as we age, the body no longer processes those amino acids into the growth hormone because the enzymes that are needed are no longer being manufactured. So it doesn't matter that you give the body the raw materials. It is not going to convert it into human growth hormone. But in any case, there's no evidence that increased intake of human growth hormone, even if it were legitimately injected, would have any significant benefit. All right, moving down the body, we make a quick stop at the thyroid gland. And that, as you know, is located in the neck, kind of looks like a shield. The word thyroid actually comes from the Greek word meaning shield. And it has a long history because goiter, which is an enlargement of the thyroid gland, of course, is easily observable externally. And Pliny, the Roman philosopher, recommended burning seaweed and eating that for the treatment of goiter. How they ever hitched on that wagon is hard to imagine, but it actually, as you'll see in a minute, was quite a correct recommendation. Because in 1811, Bernard Courtois discovered that burning seaweed results in the release of iodine, so that seaweed contains iodine. And soon after, Jean-Francois Coindet thought that maybe iodine was the active ingredient in seaweed that was needed to reduce goiter. And of course, that turned out to be correct. And pretty soon after this, they started to use it. And then in 1835, Robert Graves, English physician, described a condition whereby people suffered from goiter, that is enlargement of the thyroid gland, palpitations in the heart, and bulging eyes. And this, of course, is indicative of hyperthyroidism, when the thyroid gland produces too much thyroid hormone. And this condition has been termed Graves' disease, obviously after Graves. And today we understand that it's an autoimmune condition where there are antibodies that the body forms and attaches these to the thyroid gland. So for some reason, the body perceives the thyroid gland as to be a foreign invader and makes antibodies against it. And of course, what then happens is that the body requires thyroid hormones, so the gland tries to work harder and harder in order to produce those hormones, and it becomes enlarged. Hyperthyroidism, too much thyroid production, causes anxiety and nervousness, a very quick pulse, tiredness, hair loss, weight loss, all kinds of symptoms from hyperthyroidism. And the bulging eyes, here, actor Marty Feldman, very, very characteristic of this, of Graves' disease. So what do you do for it? There are drugs that can block the formation of thyroid hormone, but it can also be curbed by using radioactive iodine, because iodine, as we saw, concentrates in the thyroid gland. And if you have radioactive iodine, that will kill part of the thyroid gland through radiation. And that, of course, is what you want. You want it to produce less thyroid hormone. And also there can be surgery. Now, the radioactive iodine, the concept is a very interesting one, because you may have heard that in cases of a nuclear accident, people who live around nuclear power plants are given potassium iodine supplements to take. And the idea here is to saturate the thyroid gland with iodine so it will not take up any of the radioactive iodine that is produced by the nuclear reaction, and which, of course, would trigger cancer. And this has never really been put into use, so it's hard to know if it would work, but it at least has some scientific plausibility. Surgery can also be done where the thyroid gland or part of the thyroid can be removed when the thyroid is overactive. And it is not particularly complicated surgery. It has very little risk. Now, usually after this surgery, patients have to take Synthroid, thyroid hormone, because it's very difficult to judge exactly how much of the thyroid gland to destroy, because, of course, you still need thyroid hormone. So with a pill, it's much easier to balance the amount of hormone that is needed. So, in fact, it is possible to live without the thyroid gland. In 1914, Hashimoto reported a poorly functioning thyroid gland, that is an underactive thyroid gland. And he noted a buildup of white blood cells, and this eventually came to be called Hashimoto's thyroiditis. And this is a hypothyroid condition. So it's sort of the opposite of Graves' disease. And instead of being very active, it leads to sluggishness. Instead of fast heart and palpitations, it's a slow heart rate. Tendency to put on weight. When people say that they've put on weight because they have a hormone problem, this is what they are referring to. The skin becomes cold, thinking is kind of impaired, and there's hair loss. Now, the goiter can be very, very impressive in such situations. In this case, these kids have grown up in an environment where there was basically no iodine in the diet. So the thyroid gland was not able to make the thyroid hormone. It gets larger and larger as it struggles to extract iodine from the bloodstream. And how do you treat this? Well, in 1914, Calvin Kendall managed to isolate thyroxine from the thyroid glands of animals, of pigs, and pretty soon this was available as Synthroid. So today, hypothyroidism, that is underactive thyroid gland, is treated with Synthroid. And this is one of, thyroid hormones problems are ones that are amenable to medical treatment. Obviously, the condition cannot be cured. You would have to take the Synthroid for forever. But when it is taken the right dose, it certainly makes life possible. These days, certainly in the Western world, we don't have to worry that much about underactive thyroid or overactive thyroid, that is goiter, because salt contains iodine, so that there is enough iodine in the diet to satisfy the needs of the thyroid gland. Moving down the body again, we come to the adrenals. Mentioned earlier, they're located right on top of the kidneys. And the hormone that is produced in the center of the adrenal gland in the medulla is adrenaline. This is the fight or flight hormone. And it is also called epinephrine. This is the hormone that you need to increase cardiac output, more sugar in the bloodstream in order to give you energy. That's what you need under a fight or flight situation. So when you are in danger, you know that you can do things that otherwise you'd never be able to do. And that's because the adrenal gland pumps out adrenaline, does all the things that I just mentioned. Now, the outer layer of the adrenal gland is called the cortex. And this produces what are called the corticosteroids, the adrenal corticosteroids. Why cortical? Because they're produced in the cortex, the outer layer of the gland. And these protect the body from infection, exertion, and counter any allergic reactions. Now, back in 1936, Calvin Kendall, the same scientist who isolated thyroxine, isolated something he called compound E from the adrenals. And later this came to be called cortisone. A year later, Reichstein isolated hydrocortisone, also from the adrenal gland. And both cortisone and hydrocortisone, of course, have become famous. Hydrocortisone is the one that you can buy over the counter in pharmacies, and you use it on skin problems, on various kinds of skin reactions like eczema, and it works extremely well. But what was much more interesting was in 1948 when Kendall, together with physician Hinch at the Mayo Clinic, tried the injection of adrenal cortical hormones into a patient who had been claiming that she was always feeling fatigued and had no desire to do anything. And it was remarkable. Within a couple of days of being treated with this compound E, which of course eventually became known as cortisone, she actually went out of the hospital. She went on a shopping spree. So it was just something that was amazing. And then in 1950, Nobel changed cortisone into prednisone, a simple chemical conversion, and this had a better side effect profile. And this also was able to treat Addison's disease, Because as you remember from our early discussion, Addison's disease happens when the adrenal glands do not produce enough of their hormones. President Kennedy was a famous sufferer of Addison's disease, and he was treated with cortisone. Now these days, or with prednisone, these days there are many other chemical analogs of prednisone. One of these is dexamethasone, which you're hearing about a great deal these days because it is one of the drugs that is used in the treatment of COVID-19, and it was given to President Trump because it has an anti-inflammatory effect. So these drugs, the corticosteroids as they are called, are very important in medicine today. They also cause excess energy and insomnia. They rev you up. And we saw the effect of that the day after Trump got the dexamethasone, when he was saying that he felt better than he had ever felt in his life. The pancreas. The pancreas is located just underneath the liver, and it has this rather unique shape. It kind of looks like a corn cob. And if you want to see what it really looks like, here it is. That's the human pancreas. And of course, historically, very interesting for us here in Canada to talk about this because of the connection to Banting and Best at University of Toronto. But what does insulin do, which is the chemical that is produced by the pancreas? It is generally referred to as the gatekeeper for glucose. Glucose is required by every cell. This is the fuel that cells use for energy. And without insulin, glucose cannot enter the cells. This was demystified by Frederick Banting and Charles Best, University of Toronto in the 1920s, working with dogs. And they were able to isolate the chemical that the pancreas produces. And that chemical, of course, is insulin. And it was first manufactured in Toronto by Connaught Laboratories. And boy, was this ever a game changer. People who suffered from diabetes, who in those days had very short life expectancies, now could live relatively normal lives with injections of insulin. And it wasn't all that difficult to produce. It was produced from the pancreas of pigs on a very, very large scale. And it was injected. And of course, someone who had type 1 diabetes, or as it was called, juvenile diabetes in those days, would inject themselves every day and lead relatively normal lives. Now, it doesn't necessarily have to come from pigs. It can come from beef as well. They have a pancreas that produces insulin. And these days, it can also be made through genetic engineering techniques. Humalog is human insulin. And this is manufactured because the gene that codes for insulin has been isolated from the human genome. And it can be, again, inserted into a bacterium, and the bacterium then will follow the instructions of that gene and produce insulin. So insulin production these days is not a problem, and this has been one of the miraculous breakthroughs in medical research because diabetics now can go on to lead almost normal lives, thanks to animal extract insulin and now to Humalog. Now, again, moving further down the body, we come to the gonads, which may be just the most interesting ones because these are the organs, the endocrine organs. And again, endocrine organs are the organs that release hormones. In males, the testes, and in the female, the ovaries. And indeed, these are the organs that really make us into men and women. Testosterone, of course, is the main male sex hormone, and estrogen is the main female sex hormone. So the real chemical difference between men and women is either the dominance of testosterone or of estrogen in the body. Testosterone is produced in the testes. Estrogen is produced in the ovaries, but small amounts of these are also produced elsewhere in the body, in some fatty tissues, and also in the adrenal glands. Both men and women have both testosterone and estrogen. Men obviously have far more testosterone than estrogen, and women the other way around, but both genders have both of these hormones. And it is the balance of these hormones that is very important in terms of determining the so-called secondary male and female characteristics. That is the muscle structure, hair growth, sex drive, etc. These are the hormones that are really important. So obviously, when it comes to sex change operations, these hormones play a very important role. In this case here, when a man transforms into a woman, this kind of transgender situation involves obviously the use of hormones in addition to some surgery. Now, to transform a man into a woman, the surgery is obviously easier than to go the other way around, because you can more easily remove something than to add something. But anyway, to go from a male to a female, you do need to use estrogen hormones. And of course, the classic example here is that of Bruce Jenner. In the 1976 Olympics, Bruce Jenner won the decathlon, which is one of the premier events of the Olympics. And I was there. I was there in the Olympic Stadium in 1976 when Bruce won the gold medal. And it was really a spectacular event to watch. Well, today, of course, Bruce is no longer Bruce. Today, she is Caitlin, having transformed from a man into a woman. Now, it's very important to understand that these gender transformations have absolutely nothing to do with homosexuality. These unfortunate people, I think the best way to describe it is that they are born into the wrong body. They feel, in the case of Bruce Jenner, that they are not really male. They feel like they should have been born into a female body. Of course, I know it's very hard to understand for anyone who's never had such feelings, but it can make life terrible for these people. So when you can kind of, transfer, it opens up all kinds of opportunities. And so in this case, of course, there was some hormonal involvement, estrogen. Whether or not Bruce ever had any surgeries is not clear. There's never really been talked about. But estrogen is the hormone that you would have to use in order to change the musculature into a female type of musculature. Now, you can also go the other way. That is, from a woman going to a man. In this case, surgery would involve removal of the breast and, of course, the use of testosterone. And as you can see, it's quite impressive. When you inject testosterone, it certainly changes the muscle structure. Of course, you also have to do some exercise in order to really bring out the muscles. Testosterone is the main male sex hormone, and it can be injected. Now, there's an issue here because testosterone in the body also gets converted to dihydrotestosterone. That's one of the common metabolic reactions. And this results in an enlarged prostate. And this is why some of the drugs that are used to control an enlarged prostate, like finasteride or Proscar, block the conversion of testosterone to dihydrotestosterone. That's how it works. Now, testosterone, of course, is also associated with the sex drive. And the only way to know whether or not anyone has low blood levels of testosterone, there's only one way, and that is to do a test. And if a man has too low levels of testosterone, then it's possible to discuss with an endocrinologist the injection of testosterone. This is not a totally risk-free business because, as I said, testosterone can lead to more dihydrotestosterone, which can lead to an enlarged prostate. And testosterone is also an anabolic steroid. And anabolic steroids, as you'll see in a minute, can have different effects on the body. Now, if you want to block the effect of the male hormones are called androgens, then there are drugs known as anti-androgens, like Zoladex. And this, for example, would be used in the treatment of prostate cancer because that cancer is promoted by testosterone. And it can also be used as cyproterone acetate, which is one of these drugs that blocks the action of testosterone, to treat sex offenders. Men who claim that they have these unnatural sexual desires because they have too high levels of testosterone can be given this drug, which will block the testosterone levels. And this is referred to as chemical castration. And in the UK, at least, men have the option who have been convicted of these sex drives of either undergoing surgical castration or undergoing chemical castration. Now, I mentioned anabolic steroids. The term anabolic means building. So anabolic steroids are so-called because they build muscle. And this is what people who have, weightlifters or wrestlers who want, or body sculpture artists who want a lot of muscle will inject. Now, of course, it doesn't instantly give you the muscles. You still have to do the exercise, but it certainly helps put the muscle where it should be. It also can result in, extra strength, extra energy, and this is why athletes will use it. But there are issues here. In 1988, we were all thrilled in Canada when Ben Johnson won the gold medal, 100 meters, premier event of the Olympics. But it turned out he had cheated. He had taken stanozolol, which is one of these anabolic steroids, and of course he quickly fell from glory. He maintained that he hadn't done that, but it's very clear that he did. It is also clear that the Russians are into this. We've had the Russian doping scandals. The Russians have made an industry out of cheating at sporting events using these anabolic steroids. As I mentioned just before, anabolic steroids don't come without any complications. They will reduce the output of the testes because the testes then no longer have to produce testosterone, so they shrink away. There are all kinds of complications, so not a good idea to be using anabolic steroids. Now, the female equivalent of testosterone are the female hormones estrogen and progesterone. And during the menstrual cycle, these ebb and flow, that is, go up and down. Estrogen maximizes the middle of the cycle, progesterone somewhat later in the cycle. And when the levels of these hormones decrease at the end of the cycle, that's when the lining of the uterus is shred, and that's when the menses begin. Progesterone is the so-called pregnancy hormone, because it is what is needed to keep a fertilized egg implanted in the uterus so that it can grow into an embryo. And this brings up a very interesting question. How come that a woman who is already pregnant cannot get pregnant again? Now, this is not intuitively obvious. Why should you not be able to get pregnant, be inseminated again, and have sort of two buns in the oven at different times? Obviously, the human body, female body says, no. Doing this one at a time is enough. Let's wait until we get this out, until we try this insanity again. But how does the body know that there's a pregnancy underway, that there should be no fertilization? It is the pituitary gland that sends a signal to the ovaries to release an egg for fertilization, for possible fertilization. When there is progesterone in the system, and progesterone is produced when an egg has been fertilized, then this blocks the signal from the pituitary gland so that no more eggs will be released from the ovaries. Well, that's an interesting observation, because then you get to the question of what can we do chemically to come up with the so-called pill to prevent conception. All you have to do is trick the body into thinking that it is pregnant with progesterone, because then the pituitary will not release the hormone that stimulates the ovaries to release an egg. Well, the original research here, in order to get progesterone to carry out these studies, involved lots of pregnant sows, and they were needed to produce progesterone, but this was not nearly enough to do human experiments with to see if it would work as a contraceptive agent. But the company that was working on progesterone made a deal with a milk delivery company. In those days, milk was still delivered in bottles left on the doorstep. Every woman who was pregnant and who would leave a bottle of pregnant urine on the doorstep would get a bottle of milk in return for free, because this would provide the company with lots of pregnant urine to extract progesterone. Of course, the milkmen were not happy with this. So the company also made a deal with them that they would get a certain stipend for every bottle of pregnant urine they brought back. And this is where the expression, the milkman did it, comes from, because it was in the interest of milkmen to have as many women pregnant as possible. So sometimes the milkman would have done it. Anyway, all of this need to extract progesterone from urine was ended when Russell Marker, a brilliant chemist, found that there was a chemical that was present in a plant called the Mexican yam, called diosgenin, which could be in the laboratory converted into progesterone. So now there was enough progesterone, but the trouble was progesterone had to be injected in order to serve as a contraceptive. That was not acceptable, but a little bit of chemical manipulation, changing the structure of this molecule, allowed it to be taken orally, and this resulted in the birth control pill. And of course, there were many versions of the birth control pill, a lot of controversy in the early 1960s about it, but today it has become, essentially standard fare. The other female hormone is estrogen. Estrogen, again, is what makes women into women. And when you have less and less estrogen being produced in the body, that results in osteoporosis with poor bone formation and the prospect of vertebrae collapsing, etc., and hip fractures. So the question is, can you prevent this with hormonal therapy? And yes, Premarin. Premarin is so called, it comes from the urine of pregnant horses, pregnant mare's urine. That's where it is just easily available. You can extract estrogen from there, and it can be used therapeutically. But there are contraindications for estrogen. Anyone who suffers from migraine, strokes, and any of these conditions cannot take estrogen. There are possible long-term consequences of estrogen treatment. Breast cancer is the one that you've heard a lot about. It can also restore cyclic bleeding, which is a problem because most women by that time have had enough of menstruation. However, estrogen therapy, even with these concerns, in some cases can be very beneficial. So what is the truth about estrogen treatment? If you read some of the popular press, they will tell you that there's a 30% increase in breast cancer risk for women who take estrogen supplements. And then you say, oh, gee, I don't want to have anything to do with that. These pills belong in the garbage. But let me show you how numbers can be misunderstood. The fact is that in a 10-year period after menopause, the chance of any woman developing breast cancer is about 3 to 4%. 3 or 4 women out of 100 will develop breast cancer. For those who are taking estrogen, this increases to 5%. So the difference between 3.5 and 5 is 30%. That's a relative risk. What we really need to look at is the absolute risk. It means 1 extra case for every 100 women taking estrogen. Looked like that, you can also claim that it reduces the chance of remaining cancer-free from 96 to 95%, in which case you say, okay, no big issue here. Well, there are many women whose life is miserable with menopausal symptoms for whom it is worthwhile to take estrogen. So this should be discussed with the physician. But the 30% increase is a misleading statistic. Now, finally, for women who don't want to take Premarin, you go on the internet and you will see all kinds of advertisements for natural estrogens extracted from plant sources. None of these have any significant efficacy. And if they would have efficacy, then the same side effect profile would be seen as you see with Premarin. Because if something is an estrogen, then it acts as an estrogen. So if someone is desirous of taking estrogen, then it should be consulted with a physician with one of the modern estrogen supplements, not one of these over-the-counter products. And very finally, these days, in addition to all of these controversies about taking hormones, we have the issue of somehow having a hormonal effect that is undesired. So, for example, chemicals that are referred to as endocrine disruptors. These are chemicals like the phthalates or bisphenol A that you've heard about, which are found in plastics and may get into our environment and may have an effect on hormonal systems. But that's another story for another time. So I hope that you've learned something here about hormones and the questions that arise, and see what an interesting family of chemicals this is. And we'll get around to talking about all of these so-called endocrine disruptors at another time. But again, let me remind you that you can always check out our website, which is www.mcgill.ca/OSS. You'll have all kinds of up-to-date information about everything, including COVID. And you can always email me at joe.schwartz@mcgill.ca.